Good afternoon. My name is Frederick Bittenbender, and I'm Vice President of Alliance Development and State Government Affairs at the Bioindustry Organization. We're here at our international convention today, and I'm proud to be sitting next to Bio's 2012 Humanitarian of the Year Award winner, Dr. Margaret Foti, from the American Association for Cancer Research. Dr. Foti, first of all, congratulations. I think it's just a tremendous honor, and we're very excited to have you here today. Can you talk to us a little bit about what this means to you in your career?
Well, I'm absolutely thrilled to receive this award because our organization respects Bio so much. It's doing great things in terms of bringing all of the important companies in the industry together, but also you're doing an enormous amount in the area of policy. And we know that in order for science to really be successful, policy has to follow science. And so I'm just thrilled that, especially about the award and the name of the award, because it means a great deal to me personally.
Dr. Foti, your organization, and you've been CEO, I think, since 1982, has had an incredible impact on cancer research and subsequently on patients. So that's why Humanitarian is in this award. But can you tell us a little bit about the work of the American Association for Cancer Research and some of the things that are top on your agenda?
Yes. Well, first of all, I wanted to say that we're very old. We're 105 years old, and we were born in 1907, and so we have a long history of addressing the needs of the field. Our mission statement is to prevent and cure cancer, utilizing issues along the lines of research, education, collaborations, and communications. And so what we do is to really bring scientists together. We foster scientific initiatives to a great extent through our programs, but also increasingly we are setting the agenda for cancer research in terms of setting scientific priorities and actually raising funds to be able to put on these initiatives. So it's an exciting opportunity for the AACR to look at its mission, look at its goals, and actually refresh them all the time to meet the agendas of the field, which are great because still in America there are 1.6 million people still getting cancer every year, and we have a lot of work to do.
Obviously, we're in the field of biotech, and we're here at our conference looking at the incredible exhibit hall and all the companies that are working on products for unmet medical need. The biotech industry is really only numerous decades old, maybe 40 years old, but what kind of impact is it having on cancer research in your estimation?
Well, we are very proud of what's being done in biotechnology. Obviously, biotechnology uses technology to help to look at biology and really to use such biology and advances in technologies to develop drugs, diagnostics, and other products to help the public. Biotechnology, in our view, is the driver of innovation in this country and abroad. It really it's an impressive activity, and it's amazing in a way that it only is 40 years old. On the other hand, when you look at it, there's an enormous relationship between cancer research and biotechnology, because cancer research really gave birth to the field of biotechnology years ago when scientists at the National Institutes of Health were starting in the field of DNA combinatory technology. So I think it's a fascinating relationship and one that we value very much and we support very much.
That's great. Doctor, one of the exciting things I think that happened in cancer is this mass media campaign that happened with Stand Up to Cancer, and AACR was chosen to be one of the recipients of those funds, which I think was absolutely an incredible thing, and the messaging around Stand Up to Cancer really brought the plight of people suffering with cancer to the forefront. Can you tell us what this movement has meant to your organization?
Well, it's a very significant movement in the sense that it has almost doubled our budget. Of course, it's a pass-through. We take money we are given money generously by Stand Up to Cancer, and then we do the scientific review and grants administration for the best projects out there. And there's an area that you are, I'm sure, interested in, which is team science, dream teams that are working together to develop new drugs and have early patient impact. There are companies that are looking at these dream teams to collaborate with, and so for us, it's allowed us to actually give funds, important funds, at this time of cutback in federal funding to the best projects in the field, and then oversee the scientific accomplishments of these teams. The other thing that is so important is that the funds are used to support young investigators in their innovative projects that would not necessarily be funded by the National Institutes of Health. And those are projects that are supported at the level of $750,000 over a 3-year period. For a young investigator, it's a major set of funds for someone who really needs it at an important point in their career, usually at assistant professor level. So it's really doing both of those things, and the work continues. We are collaborating with other organizations to disperse these funds. For example, the Prostate Cancer Foundation, the Cancer Research Institute. So there are various other organizations that are collaborating with Stand Up to Cancer and with the ACR. And it's a great privilege for us to be doing it at this time of significant federal cutbacks.
We just saw a very compelling video about Ted Kennedy and his passion for healthcare, and one of the things it talked about is how we've seen a doubling of NIH funding and what that's meant to research. Can you comment a little bit from a policy perspective on what the NIH has meant to cancer research and why we need to continue, funding those efforts?
Oh, absolutely. So you know that funding was doubled from 1997 to 2003, and this was extremely important because it allowed for the National Institutes of Health to be able to support projects in mold diseases, including cancer. And unfortunately, as of 2003, the funding has been flat or is declining. This is a very serious situation. It's serious for the patients. It's serious for the biotech industry, which really will use these wonderful basic science findings to try to drive forward new drugs and new products. So we are very anxious that Congress and the public will look at this as an opportunity to say, let's continue to grow the National Institute's budget so that we can continue to improve the health of the public and, of course, save more lives.
Absolutely. I mean, that's really what this is all about.
Absolutely.
I mean, it's incredible. We've talked a lot about what your organization has done, what Stand Up to Cancer has meant. What's next? I mean, you accomplished so much, and you're in so many different places across the country. What's your vision for what's next for the association?
Well, we're thrilled to be in a position to be able to drive forward the next set of initiatives that we hope will help people and save more lives even. But we haven't cured cancer yet, all cancers. We have cured some cancers, but not all. The most intractable ones being pancreatic cancer, lung cancer, brain cancer. And so we will be working going forward to try to do more in these areas where there is still a lot of cancer incidence and mortality. In addition to that, ACR is beginning a project that is very exciting, and it's we will be starting a grassroots campaign directly to the public so that we can raise our own funds in addition to those from Stand Up to Cancer and expand our work as a grant-giving organization. We see this as absolutely essential at this time of federal cutbacks, and we're very excited about being able to tell our story to the American public.
Well, Doctor, I'm very proud to be able to interview you today as a fellow Philadelphian, and
thank you.
It's really wonderful, and it's obvious from this interview why you are the Biotech 2012 Humanitarian of the Year. So
thank you so much.
Thank you so very much.
Thank you. It's a pleasure.